Wikidontist.com. Truth about tooth.
Hi, I am Dr. Thomas Nechupadam and you are watching Wikidontist as a channel. We explain dental issues and dental treatments, some of the product reviews and things like that. So this is Dr. Thomas Nechupadam from Wikidontist, the complete dental channel. Today we are going to talk about what are the causes of orthodontic relapse. Orthodontic treatments are done across the world, and you might have either your own experience or somebody else who has an orthodontic relapse, or the teeth has moved from whatever treatment has achieved. So why is it so? Is it require some maintenance? How we can avoid this orthodontic relapse, or when the tooth comes back to its original position or halfway through, it doesn't look that good because you have already spent your time with the orthodontist, you went and spent your money, now it's coming back, you are not happy with it. So today we are going to talk about that. So what are the causes of relapse? One is bad habits, like if you had a habit of actually tongue thrusting, or if you are opening the mouth for sleeping, or if you are not according to, the orthodontist would have told you this is the habit which has caused you this thing, or the removal of the reason for the orthodontic problem is very important in not having the relapse, or we have to remove the reason for the tooth problem, otherwise it will once again come back. So if the teeth has a open bite, and if it is because of the tongue thrusting, we have to correct the tongue thrusting, otherwise it will come back, the open bite will once again come back. So we don't want that to happen. So what we have to do is we have to correct the habits. If you have a tongue thrusting, that has to be corrected. If you are opening the mouth, then there are products for that. All those things has to be corrected. Then another reason is most of the people say that there are spaces between the teeth gets opened up, that especially in the front, if you have a high frenal attachment, wherein the frenum is attached to your incisive papilla, then what happens is that will even if you close the space, it will open up, the diastema will open up. So we have to correct that. So the reason for the orthodontic problem has to be removed, otherwise it will come back. Now another reason is actually after extraction you get the spaces opened up in the premolar area. That is because most of the time that is because of a tongue thrust or something like that, or it may be because you might have not got the extractions proper. See, some cases the upper only is extracted, lower is not extracted, the lower wisdom tooth comes in, the lower teeth comes forward and then pushes the upper teeth forward. So the contact between the upper and the lower has to be maintained. Sometimes the doctor and the patient will insist that you should not take any teeth from the lower. I have only problem with the upper, the doctor is forced to do it. If that's such cases, there are chances of opening up the cases. So the patient has to understand that doctor is telling for his or her own good. It is not because the doctor wants to do more treatment. So, and if it is not planned well, if the patient's instructions are taken by the doctor, most of the time there is a chance of relapse. Then the most important reason for relapse is not wearing the retention appliance. There is a retention which is actually required, whether you are doing orthodontics, whether you are doing aligners, or how you move the tooth is not a question. You should have a retention plan, and you have to stick on to the retention plan. See, most of the orthodontists give you a removable appliance. Most of the patients doesn't want to wear the removable appliance because they have already worn 1.5 years of treatment. I have gone through the 1.5 years treatment. They just don't want anything in their mouth, but that doesn't help because you have to hold the teeth in that position for some time so that the bone forms around the tooth and all the periodontal ligaments relaxes before you remove the removable appliances. Before you remove the removable appliances, all the periodontal tissues has to get relaxed or the bone has to be reformed, then only you will get a desired result for quite some time. So the retention plan as per the orthodontist has to be clearly planned. Do you need to go back to the orthodontist? Yes, you need to go for reviews even after. So get a package done by the orthodontist, get it all planned before you start the orthodontics itself. There is no reason that the orthodontist will tell no, we cannot give you a package. You should ask for a package and ask for the retention plan also along with the orthodontic treatment, so that you will get a very good cost covered for this thing, and also you will get appointments for you. So you need to go for a review. If you have done a treatment, you need to go for a review and check it out whether it is going in the right direction or anything. If you once you already moved, and once the teeth has already moved quite a bit, you may not be able to get back into that position unless you do a comprehensive orthodontic treatment. So the point I want to make is, if you are an orthodontic patient and if you have done the orthodontic treatment during the retention period, go for a review, get it checked, get the little bit of relapses corrected, get the refinements done. All these things will help you. The most important thing is to get a good bite. The upper and lower teeth has to get a good bite. If the bites are proper, if there is no eccentric forces, most of the time you will have a very good teeth which doesn't move. That's the most important. The keys of occlusion, if it is proper, you will not get much of a relapse. So all these things will keep the teeth in the right position. If you have already got the relapse, don't worry about it. Get another orthodontic treatment done. Do the retention properly, then it will stay. It is not that the techniques are wrong. It is that it is not planned well, or it is not properly executed. These are the two reasons. The planning and the execution is the most important part in any orthodontic success. So please make sure that you succeed in your orthodontics. If you have already got relapses, we can correct it and get the relapse out of the question. So sometimes we need a permanent retainer. Most of the time we can give it with a temporary retainer, but only thing is that you have to wear it as instructed by the orthodontist. Thank you very much. Have a great day. Thank you for watching. Please subscribe and follow me on Facebook and YouTube. YouTube, even in Instagram I am present. So please make sure that you promote this Wikidontist channel, so that they will get more dental awareness, so that they will also get to know more about dental, all the dental procedures and things like that. Thank you very much for watching. I am Dr. Thomas Nechupadam from Nechupadam Dental at Marine Drive, Kochi.
Wikidontist.com. Truth about tooth.